Today for our clinical skills demonstration assignment, we're going to be demonstrating our feeding assist with different diets. I'm Maddie, this is Ashley, we have Kelly too.
Hello.
All right, so we're going to be taking into consideration medical conditions, dietary needs, texture and consistency, allergies and intolerances, cultural considerations, and autonomy and dignity. So what does it mean to feed somebody?
So when we are feeding somebody, we want to ensure that meals are tailored to the individual. We want patient to optimize their nutritional intake, and we want to support the recovery and autonomy as well.
We're going to be considering medical conditions, which can be diabetes, kidney disease, heart disease, and celiac disease. So for our diabetic patients, controlling their carbs and sugar will be very important, lowering those and controlling their sugar intake. Kidney disease, we're going to be having low potassium and low sodium. Heart disease, we're going to have low sodium, low fat. And celiac disease is all gluten-free. Next on our list, we have dietary needs. So these can vary depending on different patient needs. So if, for example, the patient was going and recovering from eating disorder, we would have to take in consideration their calorie restrictions or increases depending. And then for wound healing and tissue repair, upping the protein intake, and then different vitamins, minerals, depending on if they had a deficiency or if they had any toxicity in the past, like for their vitamins and minerals.
So one thing we need to look at is different textures and consistencies for diets. One, we have clear liquids, which is like your coffee, tea, fat-free broths, clear fruit juices, gelatin, and popsicles. Then you have a full liquid diet, which is the same as the clear, but you add in a little bit more, so smooth textures like dairy products, strained or blended soups. Then you have a thickened liquids, which includes these two, plus you can add in some scrambled eggs, pureed meats, vegetables, and fruits. We also have purees, which can be just meals that are put into a blender. Mechanical soft diets, which includes all of the above as well, plus ground or diced meats, cottage cheese, rice, potatoes, pancakes, bananas, and peanut butter. And then soft, low residue, which is like a low fiber, easy to digest, foods such as pastas, casseroles, and moist and tender meats. Another big thing that we have to consider are allergies and intolerances. There are kind of big, there's 8 big allergies that we kind of have to watch for. Those include milk, eggs, fish, shellfish, tree nuts, peanuts, wheat, and soybeans. And then there's also a lot of intolerances. This includes gluten, lactose, caffeine, fructose, and some sulfites.
So when we're feeding patients in hospital, one of the things we need to be cognizant of is any cultural considerations they might have with regards to their diet. For example, a lot of people of the Jewish faith only consume a kosher diet and all of the rules that go along with that. Buddhists and Hindus often only consume a vegan diet. Any religions for Islam typically do not eat pork. They also have specific calendar restrictions. For example, during the holiday of Ramadan, Islamic subjects do not eat from sunup to sundown. They're not allowed to eat until sundown. Also, we've got, for example, Orthodox Christians often have restrictions for days of fasting. Catholics observing Lent don't eat meat on Fridays. They deny themselves certain things. So these are things that you need to take into consideration when planning somebody's diet. The final thing that we need to consider, but also one of the most important when feeding a patient in hospital, is to consider their autonomy, their respect, and their dignity as a person. And there are several different ways that you can do that. For example, offering them a variety and a choice of what they want to eat rather than just dictating what they're going to eat at every particular meal. Allowing them to be part of meal planning. Addressing any stress or anxiety they might have with food or meals. For example, if you're treating somebody with an eating disorder, they're likely going to have anxiety regarding their meals that you're going to need to take into account. Also, people who were previously independent who are now fully independent might have some embarrassment and shame over having to be fed by somebody. You have to take into consideration and respect their privacy and their dignity. And then lastly, don't rush them. I think that's a big one we need to talk about. Don't rush the meal because you've got stuff to do. If you're feeding a patient, this is their meal, this is their time to relax and enjoy their food. So don't rush it. These are just ways to preserve their respect and dignity.
When we first walked in, we performed a first look assessment at the doorway. Was our client alert? Did they hear us? Is our client breathing? Is the client losing blood or has obvious evidence of lack of perfusion?
We were also able to assess her mood and her emotional status. And while feeding, we can also kind of assess her cognitive ability and her ability to swallow.
One thing we're looking for before we begin to feed a patient is to assess the patient's risk for aspiration, to assess their level of alertness, their gag or cough reflexes, any difficulties they might have managing saliva.
When assessing if a patient has dysphagia or not, it can be important to determine their health history. Have they had a stroke? Do they have cerebral palsy? Do they have any reason that could affect their ability to swallow?
We can delegate the skill of feeding assistance after the initial assessment to a CNA or a willing family member. Hello, I'm Maddie. I'll be your student nurse today. How are you feeling? Today I brought with me one wet washcloth and one dry washcloth to wash the patient's hands before we begin our meal. In addition to that, I've brought a clean towel just to cover up, make sure if there's any spills, the patient is not getting spilled on. I've also brought a eating utensil, and our patient today is on a thickened liquid diet, applesauce today, because they are having trouble swallowing.
For people that are at risk for dysphagia, it is important to remember to raise the head of the bed to 90 degrees. They also need a 30-minute rest period before eating. When feeding patients, it is important to perform hand hygiene. We prefer using one wet washcloth and one dry washcloth to make the patient feel like they are washing their hands as opposed to just using alcohol.
Then my dry one.
It's important to put a cover on the patient to protect their clothing from any spillage or food.
When feeding patients with dysphagia, it's important to always give them small bites and let them chew their food thoroughly and swallow it completely before giving them any more.
When feeding the patient, it's important to sit next to them to make them feel more comfortable and to preserve their autonomy. Small containers are beneficial because you can properly assess how much of the food the patient has consumed. You also want to flex the patient's head slightly down. If the patient has unilateral weakness on one side, possibly from a stroke or anything, then it is important to place the food on the strong side of the mouth. Some safety concerns to watch out for when you are feeding a patient. Obviously choking and problem swallowing, but are they coughing? Do they have a change in voice tone or quality? Are they having abnormal movements of their mouth, tongue, or lips? Do they have slow, weak, or uncoordinated speech? Or possibly even an abnormal gag or delayed swallowing. Another thing to watch for is silent aspiration, which usually you can't tell right away, and it occurs without a cough, and it's more common to find later on, possibly even the next day. When discharging patients, it is important to provide them with a dietary plan and go over it thoroughly with them and make sure that they understand it. It's also important to collaborate with other healthcare providers. You can work with an occupational therapist who can provide them with utensils that are easier for eating, or even plates with larger sides for them to hold on to. Speech and language pathologists are important because they can help them with swallowing exercises to help reduce the risk of aspiration. And then finally, including their family in on the plans can help as well.